Hello again, this is Sherry Barr. We're ready to start Unit 2 of our pharmacology class, Week 1. This time we're going to discuss the drug approval process and how that takes place. This is some of the rules and regulations to drug administration. This is Chapter 6 in our 7th edition book. Looks like on our handouts this was made from an earlier edition. Our learning objectives for this chapter are we want to compare and contrast the chemical, generic, and brand names of different drugs, and we want to describe some of the drug regulation and development of these medications. Pharmacology can be defined as the study of effects of a chemical substance on a living tissues, very simply put. Medications or drugs have been around for many, many years. There are records of when in the early drugs that came from plants, from animal byproducts, and from minerals. Records date back that we have back to 2700 BC, and these are from the Middle East and from China. Most common drugs during that time were laxatives and emetics. So they were having a lot of diarrhea and a lot of emesis during that time, most likely due to the things that they were eating and they were being exposed to. In 1550 BC, the Egyptians actually started a record keeping of their different medications and what they were being used for. This was called Eber's Medical Papyrus. It is still in existence, and some of the things that were found in there is that castor oil was being used as a laxative, even back that far. Opium was used for pain control, and moldy bread was used on wounds infections. And that was 3,500 years before Alexander Fleming discovered penicillin. So that's pretty amazing. Back in our country, they developed in 1820 the United States Pharmacopoeia National Formulary. This is still publicized. It gets 2 supplements that come with it. It's actually 3 volumes. And this maintains high standards for therapeutic use, for patient safety, for the quality and purity of the drugs, the strength of the drug, its package safety, and dosage form. All the drugs within that have a USP stamp of approval on them, and they will have that also listed on the medication itself. This was one of the first true measures of the standards within our country. Then if you look in your book, starting on page 109, in 1938, the U.S. Food and Drug Administration was developed to monitor and regulate the manufacture of some of these drugs. They put together an act that was put through Congress in 1938, the Food, Drug, and Cosmetic Act, and that empowered the FDA to monitor and regulate these drugs. And it's the FDA's responsibility to make sure that all drugs are tested for any harmful effects that there may be on these drugs, that the labels have the accurate information that the patient needs, and to enclose in the drug packaging detailed literature about that drug, and in that explains the adverse effects that may take place. Well, then in 1952, Durham-Humphrey made an amendment to that, and it distinguished which drugs could be sold by prescription and those that could be sold without a prescription. And with that, they also went a little further, and they also said that you could not refill. There could not be a refill, automatic refill, for any drugs that were narcotics, tranquilizers, or hypnotics. So that was kind of an important development then. In 1962, there was an additional amendment to that 1930 Act by Keffler and Harris. And that was because in the 1950s, there was a medication that was being given to a pregnant European woman that it was like a sedative hypnotic medication. They were having a lot of morning sickness, and also they gave them this medication in the first trimester. But when these babies were born, they had a lot of limb deformities. So that amendment came into place to tighten the measures and the evaluation of the testing methods before these drugs were given out to the public. Then back in the 60s and 70s, there was a lot of changes in our culture within the United States and all, and we started having a lot of drug abuse problems. So in 1970, the Controlled Substance Acts of the Comprehensive Drug Abuse Prevention and Control Act was developed. It was passed by Congress, and that was to remedy the growing problems we were having with drug abuse. And in doing so, it had several provisions, and one of those was to promote drug education and research into prevention and treatment of drug dependence. It also increased the authority, the law authorities and the drug manufacturing authority, the enforcement of these regulations. Excuse me. They established treatment and rehab facilities for drug abuse cases. They also designated a schedule or categories of these different medications, all these controlled, and that's all based on abuse liability. And if you'll look on page 110, you'll have a list in table 6-1, scheduled categories for controlled substances. Scheduled 1 drugs on there are drugs that have no medical accepted use that we use these for at this point in time, and they have a high potential for drug abuse. These are heroin, LSD, marijuana is on there, peyote. These are all, we don't have an accepted medical use for them at this point in time. In Schedule 2 drugs, these have a high potential for drug abuse, but we do use them for in the medical setting. And these are like Demerol and morphine, hydrocodone, Lortabs, amphetamines, pentobarb. So we do use those, but those are scheduled drugs. Scheduled 3 drugs are codeine preparations, non-narcotic drugs that are used. These have still have a potential for abuse, but not as strongly. Schedule 4 drugs are your phenobarbs, your Valium, your Ativan, your benzodiazepines, chlorohydrate. These drugs we use in medicine, and they still can cause dependency, so it's something that has to be on the controlled list, but not as high a potential. And then Schedule 5 drugs, these are drugs that have a very limited potential for abuse, but they still need to be monitored. And these are drugs that are used for like opiate-controlled substances. They use for diarrhea. These are like codeine they put into cough medicines to help control coughs. So those are the ones that we look at there. Now, some of the nursing implications of controlled substances, those are important to know. All of these drugs have to be accounted for. They're all controlled. There's a reason for it, and we have to keep good records for it. A lot of these times, these drugs, you have to have a cosigner on any waste or discard. Say if you have a syringe that has 10 milligrams of morphine in it, and you're only going to use 5. You're going to waste the last 5. You have to have somebody witness your waste and cosign with you to make sure that that's done. All records have to match up. All the drug that was given, the amount wasted, it all has to total up. A lot of times you'll be giving medications like these in a PCA, a patient-controlled delivery system within the hospitals, and it comes with a large syringe that goes into this machine with a large amount of the drug in it. So now, as soon as the med's DC'd from that patient, they're not on it any longer, well then there's waste in there. So you have to have 2 people sign off that waste, and the records always must match. These drugs are also kept in controlled, locked storage areas. Narcotics are double locked. There's 2 locks that have to be able to get into it. There's also currently in most facilities, the larger facilities, they have like a PCC system or Omnicell system, which is it's a bioidentical identifier that's used for access. You have to have codes to get into it, and you have special codes for each patient and what their drugs are ordered. And there is mandatory reporting on staff and the hospital if there is any diversion that has taken place. Like I said, these remain under lock and key, double lock, and only authorized person have the access to these. Some of the other things you need to know about Nurse Practice Acts. Every state has a Nurse Practice Act, and in that it outlines the laws regarding drug administration by nurses. As a nurse, you need to know what those rules and regulations are with your licensure, of what you can and cannot do with your license. And each state is different, so the state that you're licensing, you need to know those rules and regulations. You can get a copy of that by calling your state board of which your license is from, and just read it and be aware of it. And you have to know these because a nurse can be prosecuted for giving the wrong drug or dosage or missing any of those rights. So you do need to be aware of that. One of the things you do need to understand too, that there's terms for these offenses. And some of these are misfeasance is one you need to understand. And that's negligence. That's giving the wrong drug or the wrong drug dose that results in a patient's death. That's misfeasance. Now, nonfeasance, that's the omission of. That's omitting the drug that results in a client's death. That's by not giving the drug that was needed to give. And then you have malfeasance. And that's giving the correct drug, but by the wrong route. And that results in the patient's death. So these are terms you need to understand. Again, misfeasance is neglect. Nonfeasance is omission. And malfeasance is giving the right drug, but by the wrong route. So just so you understand that. Some of the other standards that you need to be aware of is the Canadian drug regulation. With all the different people coming from different countries, we get a lot of different Canadian people that come here, plus people get drugs from Canada. You've seen those Canadian drug stores, this kind of thing. So you need to have an awareness of it. They have a similar system to ours. They have a system that is set up designed for just the scheduled drugs that are prescription. Then they have one for that lists controlled substances. It's similar to ours, but it is a little different. And it outlines it very, very nicely here on page 111 in your book there. Now, you also need to be able to find out resource. A nurse has a right to be able to find the resources because there's so many meds. You can't keep them all straight all the time. So you need to have access to places to look up these drugs so I'm sure you're giving the right thing. A real good one is the American Hospital Formulary Service. That is something that every hospital has. It's published yearly. It's very accurate. It's complete. Another one is the drugs, facts, and comparisons. That's in most hospitals. You'll find those. This is all the U.S. drugs prescribed and all the over-the-counter drugs, and it is also a very accurate and complete compilation of it. The gold standard is the U.S. Pharmacopoeia drug information. That most hospitals and pharmacies have this. It also gets monthly supplements to update it. Another source that you can find in most facilities is your PDR. It's your prescriber's drug reference, and it's put out yearly. It's got 7 sections, and it's a good quick resource. It has 2 sections that are very informational to the nurse. But just to be aware, it doesn't provide complete information. There's a lot of the pharmacological breakdown of the drug that's not provided. Plus, there are no nursing interventions that you need to know. There's things you need to know about the drug before you give it, and it's not real thorough on that. There's lots of different nurse drug guides out there. There's handbooks on injectables. Just be aware of when you're buying things like that. Make sure that you are buying good quality and come from an informative source. There's other things like Hippocrates or Pepid online for nursing on their downloads. You can download them to your smartphones or your iPads, that type of thing. The other thing is you can get information on the internet on just about anything you want to know about. But just be careful because anyone can post on the internet. And the information may or may not be accurate. So it's just keep that in mind. Then when you get to some of your ethical considerations, we did talk about the pregnancy categories previously. We talked about that. So be aware of that for your pregnant patients and clients. Poison control centers. You need to know how to get a hold of them. There is something like, I think I read that was 27,000 poisonings within a year in the United States alone. 70% of those are accidental, 30 of them are suicides. And you need to know how to get a hold of the Poison Control Center. The one national number you can just keep in the top of your head if you can remember, it's just 1-800-222-1222. So if you keep that just in your mind, you can always call them with any questions or concerns and then get information very quickly. I believe in the front of most phone books, there's poison control information listed there too, how to reach them. As for the ethical, nurses should be ethically, morally responsible for their patients' total care. That is the rules. Nurses should be morally and ethically responsible for their patients, their total care. You must respect the rights, dignity, and wishes of those clients. Patients have rights to know about drugs, their actions, and their side effects, and they have the right to refuse. So you need to practice in your nursing profession in that manner. All right. Practice question number 1. Drugs proven to be a risk to human fetuses include which of the FDA pregnancy categories? Which one is that? C and D. That is correct. Practice question number 2. When a nurse gives the wrong medication to a client and the client is harmed, the offense is termed. Okay, now this one is giving the wrong medication to the client and the client is harmed. So now remember, misfeasance is neglect. It's giving the wrong drug, right? Nonfeasance is omission. It's omitting the drug. And malfeasance is giving the right drug, but by the wrong route. All 3 result in death. So the answer to that question is A, misfeasance. Okay, well that about does it for this chapter. I will see you again and we'll do unit number 3 on week 1. Thanks.